Hello and welcome to the Shrink Down. In today's episode, we're diving into dyslexia in honor of Dyslexia Awareness Month. We'll explore what dyslexia is and, just as importantly, what it is not. We'll also discuss early signs, common symptoms, the importance of early detection, as well as effective treatments. Plus, we'll highlight some well-known individuals who have dyslexia. But before we jump into today's topic, let's start with our 4-minute faves. All right. Wilhelmina, why don't you start us off? What are you sharing and loving today?
Yes. So I'm a big reader, and I'm usually reading at least 2 books at the same time. Usually reading something fun.
Oh, I guess I do
Sometimes
that too.
3.
I
Sometimes
did not
3.
do that. Wow.
So, I usually am reading something fun for myself, for my book club, and then usually reading something either for my practice or just sort of for growth. And so right now I am reading Releasing the Mother Load: How to Carry Less and Enjoy Motherhood More by
Ooh.
Erica Josa.
Okay.
So Erica Josa is a therapist. She founded MomWell. She's very popular online, like her Instagram following. And this book came out this year. And it is everything that has been coming up with the moms I work with in my practice, where things that we're talking about, things that I'm talking about with my mom friends, the idea that, I mean, in general, I love right now that there's more and more topics that are being talked about, being brought into awareness, that have reduced stigma, have made people feel like they're not the only ones that are feeling this way. I remember when we were trying to get pregnant long ago and we had a miscarriage, and suddenly all of my miscarriages are so common, and they have been forever.
Right.
And yet they just were never talked about. It was like
Right.
talked about
Right.
in whispers
Right.
and so when women would have it, they would carry some shame, even though it was unnecessary, of course. But then when they started talking about it more and saying like, hey, this is actually statistically very common, I know it made me feel better. And I know it's made many other women who've had miscarriages feel better. That's exactly how I feel about this book and what it is bringing to light about motherhood today, in that so many of myself and so many of my mom friends, you guys, we talk about how hard it is these days to work full time,
Right.
have our practices, have kids in a very active age of life, have a partner, especially if our partners are traveling or work long hours, and still be usually primarily the mental load carrier of the family, meaning we're the ones making the appointments, making the doctor's appointments, making sure they get their flu shots, parent teacher conferences sign up, all of that traditionally and usually falls to women, even though they are still working the same hours that their partner's working. And that has been talked about. But what hasn't been talked about is this invisible labor. So it is all of the things that go into the household and household management and parenthood that never gets talked about, but is traditionally on a woman's plate. So
Okay.
I always laugh. The example I give is I put things on the stairs to go upstairs. And it's just I'm going to put something in Maddie's room. I'm going to put a pair of shoes back. I'm going to whatever. I put them on the stairs to just take up the next time I go. Literally no one else will ever pick that
Go
up.
walk past it.
It could be there for the end of time if I did not bring it back upstairs. The clutter around the house that my husband, he's kind of a clutter bug. Like he's fine with it. I'm like, if I didn't pick this up, it would never get picked up. It just wouldn't. It just would not. So meal prep is another one. Now my husband's really good with this one, but like a lot of women talk about, they're the ones that are planning the meals, getting the grocery shopping, making sure, lunches, all of that. So anyway, This book talks about that. Sorry, I could go on. This is a topic. This is something I talk about in my practice.
Topic.
Yeah.
I'm sure we'll talk about.
gosh.
We'll do that one of these days.
So this one just really talks about all the assumptions we carry that have kind of led to this, that kind of perpetuates it, things that you can do, discussions you can have with yourself, with your partner, to sort of unburden some of these things and to really make motherhood more enjoyable. So I am loving it. Highly recommend.
Excellent.
Great.
Yeah,
Terry, what are you What are you loving these days?
Okay, so this was a last minute pick. Based on a segment of our show. This the Birkenstock Boston
Oh, that's an
Pod.
old school one.
Oh.
So
Oldie but
people
goodie.
who were teens in the 90s might
Yeah.
remember that kids who
Mhm.
bent towards the hippie look a bit more
Yeah.
Yep.
needed to wear
Yep.
these.
Yep.
So
The
I
whole
didn't
phase.
actually have a pair in high school, but they've made a resurgence. Like in
Mhm.
general, I love
Yes.
Birkenstocks. It's pretty much what I wear most of the summer. I've traveled through Italy wearing them, have been able to walk for hours and hours. But this, I think it's called the Boston,
It's
is
called the what?
awesome. The Boston, I think that's the
Boston.
style
Okay.
is Boston. This is so cute for fall
It's
with
really
jeans,
cute. Yeah.
and they're just as comfortable. I am loving them. I get tons of compliments on them. But the only glitch is the weather has to be cool, not wet
Perfect.
at all. It
Yeah.
has to be perfect because otherwise they get
Yeah.
real yucky. So,
And
Yeah.
you can spray them because they're suede. Not that that's 100%
you
proof.
know what though? When I've sprayed other this, they end up getting yucky
Crunchy.
and and crunchy.
Crunchy.
Yeah.
Yeah, I like them nice and soft. So I
Oh my
recommend
gosh.
in a particular set of weather climate and
Yeah. Right.
outfit, very
Which
cute.
happens all the time in Chicago, right?
Yeah. So basically you can wear these twice in
Right.
Chicago.
They stay in great shape.
2 days of the year.
So,
They're
They're
gonna
great.
look so cute in
yeah,
them
They're
for
gonna
those
look
2 days.
2 days.
amazing.
2 days. Well worth it.
Right. Right. Right.
Oh
That's funny.
gosh. All right. How about you, Lauren?
So my 4-minute fave. So I'm going to do something that'll be I sort of tie in to our topic today, which is a book for kids as well as a TV show. So the reason I'm choosing this is because my son is currently reading one of the books in the Percy Jackson series.
Yes.
Yes. So Percy
I
Jackson
knew
and
that.
the Olympians. My son chose it he has to do a book report coming up
Is that the first
for
one or like the main one? Because I've been wanting to get my 4th grade. I feel like he'll like them.
Well, so
There's a
there's
whole
a whole
series.
series.
Yeah.
So my son is
Spin-off
just
series.
he happens to be reading the 3rd one in the series right now, but
Okay.
because he had to choose a fantasy fiction book. Okay. But we actually the reason they got into the books, both of my kids, is because we watched the television show, which
So
has been streaming on Disney Plus just within this last year, right, Wilhelmina? Because I
Yep.
know both of
Yep.
our families watched it.
Mhm.
And oh my gosh, so well done.
So good.
Based on the book series, Disney Plus, but that got the boys interested in reading the books.
Mhm.
So one of the things that I often, and we'll get to more recommendations, but this is one that's just sort of an off the cuff recommendation when I'm talking to parents about how to encourage reading for kids, especially these kids that struggle with reading. And my kiddos do not. They're fortunate to be able to read their sort of grade level books. But for kids that are more avoidant or just don't like it, they don't have that interest or have a learning disability, one of my favorite things to do is to suggest that parents pair a book with a movie or a television show or something like that, right?
Yep.
So you can start really simple, right? There's really, Diary of a Wimpy Kid is a great like example of something that's
Yeah.
kind of straightforward that kids can kind of sink their teeth into. And then they've got some great movies, a couple of them
They
actually,
do.
associated with those books. So current 4-minute fave for us is we're into the Percy Jackson books right now and looking forward to, I think there's a 2nd season coming out
Yes, there is.
soon.
Mhm.
Yes.
Mhm.
For the Disney Plus television show. So.
And there's a little dyslexia reference in the first book, or at least
Oh
it's
my
in the movie.
gosh,
Is it in the
remind me.
movie?
Yeah.
Yeah.
Remind me.
He thinks he has dyslexia because he can read Greek.
Oh, funny. I love that.
Yeah. Yeah.
Which would be a myth. We'll talk about that.
Yes, I know. I was actually gonna bring up Percy Jackson as
I
one of my
love-
questions.
I
Yes.
love that. That's very cool. Yes. All right, Vanessa, what about you?
Okay, so I started off on the first few podcasts, I shared like just beauty faves and stuff. And that's like something that I really enjoy. And I kind of shared some other things along the way. So I'm going back to something that I like that's makeup related. So I'm sharing today Tarte's Double Take Eyeliner. And I'm also going to share a hack that I do with this. So this eyeliner has one side is pencil, like gel pencil, and the other side is liquid eyeliner. And so you get both in one, and they both work really well. But so I really love this. I've bought this I don't know, a bajillion times already. So like it's one of those things that I'm like, I'm always going to go back to, and I will probably never change. And Tarte always has sales. So just look around for sales. They really have good sales. So I always buy, so if it's on sale, I'll buy like 2 of these at the same time. So I really love this product. But my hack is, and I used to do this back in the day. I don't know if you ever did, but when I used to get my Wet n Wild eyeliner that I had to sharpen, it never like would work all the time. So I would take a lighter and like light it for like a second. Do you guys remember this?
Warm it
Oh,
up.
I'm doing this in high school.
And then, so yeah, so ladies, if you are, you know, from our generation, you will probably know that trick. Yep. So I used to use a little match, light it real quick, and use it. So it kind of was more of like a liquid eyeliner. And then at some point I started using like a pencil and then going over it with the liquid eyeliner, which is my hack. So that's what I still do to this day. So I find that drawing a straight line with liquid is hard.
It's really
hard. So it's so hard. So I draw it with the pencil side, like draw my line, and then I go over it with the liquid side. And it just, because the liquid makes it just darker, it's like a bolder black or whatever color you're using. So that's what I do. That's my hack. So I use pencil first, and then I go over it with the liquid, and it just makes it so that it's perfectly straight and it's nice and like bold color. So
I was going to ask
stays
you,
longer too.
because I can never do
No,
the liquid eyeliner.
I know that's
I
hard.
just,
Yeah,
I
it's
like
hard.
look like it's just like, oh no, that's just coming off. That's just coming right off.
Oh, you tried something there.
Yeah, so you do it with the pencil first, and then you just do like one coat of the liquid over the pencil. And I've been doing this for years. So I used to buy my little like, you know, pencil, like I'd sharpen it, and then I'd buy my liquid and I'd do them together. And then when I saw this, some Instagram person that I follow, influencer, I was like, wait a minute, it's all in one thing. So I still use that trick. So now I've shared with you my favorite eyeliner and my eyeliner hack.
There you go.
I love it.
Great.
All right. Now that we've shared our faves, let's get into today's topic. And so you may be wondering why, of all the things that we are going to be discussing this week, why we picked dyslexia, because there's a lot of, different things that are going on for October. So there's like Breast Cancer Awareness Month, it's National ADHD Awareness Month, but we chose dyslexia because this is something that 3 out of the 4 of us do as part of our practices. So Terry, Lauren, and myself focus on assessment. And so we see kids with learning differences, and we know that the most common type of learning disability is actually dyslexia. And so we see a lot of this in our practices. So we thought we would share our insights on dyslexia. And so I thought it'd be good for us to start off with what is dyslexia? Because we know there's a lot of times we have parents come to us and they kind of have this idea of what dyslexia is, and they'll say, oh, my child does X, Y, and Z. I think they have dyslexia. And sometimes they are accurate, and a lot of times they're not.
Right.
So let's start off, I think, with what is dyslexia, and that kind of will also kind of go along with what is not dyslexia.
Right. I'll take it. So dyslexia is a specific learning disability, as Vanessa noted, and it's neurodevelopmental in origin. Right. So it has to do with the brain. It's there from when they were born. It's how our brain is organized. And really, it's a deficit in the way that the brain processes language. Okay. So we'll talk a little bit about what it's not, but it's definitely nothing to do with vision. And that is the thing that we hear quite a bit when people come into our office. I think they're reading backwards. I think they see the words backwards. Now, they might be reading the word backwards, and we can talk a little bit about why that is. But it's more because they're guessing, because they don't process the language in the same way as another brain. Okay. So as a brain that's learning to read typically. Okay. It impacts so many things though. So this is what's interesting, I think, about dyslexia, is that it's not just an impact on reading fluency, which of course it is, but it impacts things like the ability to decode new words or new language, spelling. It can impact math facts, right? Because that's processing of language. To memorize multiplication facts is processing of language, or a symbol system, if you want to think of it that way, right? It impacts reading comprehension. If the brain is constantly focused on decoding the new words, then it's not going to comprehend what it's reading while it's decoding.
Right?
Right?
Spending all their energy on trying to figure out the words. It leaves very little left to actually know what you just read about.
Right. And the other thing I would say that kind of goes along with sort of what it is, it's also unexpected. So these are kiddos that otherwise, and this is what we hear a lot from parents, which is absolutely true. They appear bright. smart, like with it kiddos, and they've had effective instruction in school. Might not be the right instruction for them, but it's been consistent exposure to instruction. So these are not kids that haven't been in school, right? So that's really kind of the crux of what dyslexia is. Terry, do you want to tell us what it's not?
Sure. So it is not seeing words backwards.
Yeah.
Right. It
We
is
hear that
not
so often.
flipping. Right. It's not. Now, while a lot of individuals with dyslexia will write D's and P's or D's and B's or P's and Q's and flip the loopy part over, that in and of itself is not always diagnostic of dyslexia, because that a
And
lot
I'll
of
just
kids, very neurotypical kids, have that. I would say until about second grade, even third grade, if we're being generous, you can still flip those letters. But it is definitely not a disorder of vision. It is not a disorder of seeing things backwards or seeing them alternatively. The other challenge, I think, is that a lot of parents, and you spoke about this, Lauren, will say, we just thought it would come along eventually, right? So we think that, they're really bright, they understand lots of other things,
learn.
but maybe they're just slower to learn. And maybe if we let's just give it through first grade. Let's just give it through second grade. The wait and see approach has categorically been the standard for children when it comes to reading development and reading skill development. It also is the biggest hindrance and the most problematic thing we can do for kids with regard to their emerging reading skills.
Yeah, I think if people can understand some of the early signs. So we know that delays in language is a big one. Not all kids, but that's a red flag. And then having difficulty with those early pre-academic skills, like recognizing, learning the alphabet. So there are some early signs that parents can see, already pre kind of getting into school, right? So those are things that I think will be helpful for parents to be aware of. But I have also found in my practice that parents will say, I've always thought something's going on, and I will ask the teacher, and they keep telling me it's okay, it's fine, they're just behind, they'll catch up. And so I do always want to encourage parents that if you think there's something going on, use your parent instinct, your gut. If you think there's something wrong, there's nothing wrong with going to see someone to figure out if there is, right? To have an evaluation or even a screener, right? You can even do just a screener to determine if there's something going on worth kind of further evaluating. And it's especially important, like Terry said, because early intervention is so important. I just went to a school, like literally, like last week, went to this school that was having an open house about this new program. And they said, we don't typically recommend kids get evaluated until third grade. And I was like, oh my gosh, no.
We hear that all the time.
Well, right. And I didn't say anything at the time because it wasn't really like an open kind of discussion kind of presentation. So I emailed them later and said, actually, it's really better to, if you have a concern, to intervene early on, and maybe not sending these kids for full evaluations, but at least figuring out, doing a screener to determine if they're behind and would benefit from a thorough evaluation, because early intervention is key.
Is there a screener that parents could do? Like if they, had a suspicion early on that, something that they could do?
It's a good question.
Lauren, I see you shaking your head no. So nope.
Well, so yes and no. I don't think that there's not a standardized screener that parents would be able to administer.
Right.
That said, Terry and Vanessa both touched on early signs and symptoms. And I think if you're noticing a few of the following things, it would be worth saying, we're not going to do the wait and see. And again, maybe not a full evaluation, but just start treatment. I have kiddos that I'll evaluate later on, like third, fourth grade, that have been getting the appropriate instruction for a couple of years because the parents said, I just decided to start the treatment. And now the tutor, the specialized instructor is saying, okay, now let's get the diagnosis for you so that we can get some supports. But things like, Vanessa had mentioned early on, like delays in speech, but that doesn't always have to be the case.
Right.
There are signs and symptoms that you might not find necessarily in a list online, but that we as clinicians, I think, see. And they're really, you could call them like ancillary symptoms of dyslexia, but things like word confusion, right? So you could call that part of like a language delay or difficulties with language. processing, but things like saying volcano for tornado constantly,
Okay.
like confusing words quite a bit, difficulty with rhyming,
Mhm.
okay,
Mm.
difficulty with learning different symbol systems. So like days of the week, months of the year,
Mhm.
Oh.
your address, your phone number. The phone number one is tough nowadays because like so many kids are not learning phone numbers, but it is still one. Their birth date. I always ask young kids their birth date to see if that's because those are all systems, just like math facts, right? That you have to be able to process and get in the back of that brain for memory purposes. And that's really where the brain struggles, is in organizing that information. So if little kids are struggling with things like, or just letter recognition, learning the alphabet, right?
Mhm.
Rhyming. So those are like pre-academic preschool kinds of things where
The
you could
sounds of
say as a
letters.
Sounds of
parent, like,
letters.
okay,
Yeah.
we had this
Mhm.
difficulty when they were in preschool. Now in kindergarten, they can't learn the alphabet. They can't write it. They're having a really hard time identifying the letters. And then there's these other things here, like they have no idea what tomorrow is. They don't know their days of the week. They can't tell me what yesterday was. Like those kinds of systems that kind of involve processing of symbolic or language-based information are really good indicators for parents that they could just, and I have some parents that write little notes and they're like, all right, here are the things that I'm noticing. But even if they're not noticing, we as clinicians often ask those kinds of questions.
So if you asked a kiddo with dyslexia what the date is, what would be a response that they might give? Like, or their birthday. Well, if you asked a kiddo what their birthday is, what might be a response they would give?
I don't know.
What I've
Or a
heard
lot
is
can say the
May.
name.
They might say May because they might know the
Yes.
name of the month. But if you said,
They often don't know the year.
they often don't know the year,
That's
they
I
might
don't
not
know.
be able to
Yeah.
say, oh, it's 5/11, May 11th. But they might be like, it's
Right.
in May,
Okay.
it's
Not
May
as
1
fluid.
1, or
Yeah.
it's May 11th. But I also think it depends on the age. So, like Lauren
Yeah.
mentioned, the
Right.
Of course.
presentation
Yeah.
varies. There's a lot of kids and even teenagers that I've evaluated over the last couple of years, sort of post COVID,
Yes.
where a little red flag was raised prior to COVID,
Yep.
maybe in
Yep.
January, February
Mm.
of 2020, and then everything shut down. These kids were in second or third grade. Everything was
Yep.
remote, and then we're circling back. And so a
Mm.
lot of it, I think, is these are kids where I've said to parents, they've received some decent instruction, maybe some private tutoring, maybe some good one-to-one or small group instruction at school. I think if I had evaluated them when they were in first, second, or third grade, they probably would have looked more dyslexic than they do
Mhm.
now because they have developed
Right.
compensatory strategies. They
Right.
have
Mhm.
found ways to,
Mm-hmm.
develop good comprehension skills because by definition, it is an unexpected learning difference. These
Yeah.
kids tend to be quick thinkers, good problem solvers, really good
Yes.
analytical reasoning skills. They can mask their dyslexia as they age and progress
Mhm.
pretty
Mhm.
well. And
But spelling usually is a
spelling
indicator.
is
At those
so,
older
Yeah, that's a
ages, they
big one.
can't mask that.
Yeah.
yes,
Is
that
the
is what
writing
is
piece.
most
Days.
diagnostic is when you do
Yeah.
the spelling testing as part
Mhm.
of the assessment. You're like, oh, there's where the decoding and the phonological processing is really breaking down. And it becomes really evident when you look at
Yeah.
the spelling. And
Yeah.
Well,
yeah,
and that was one of the, I remember you guys, have talked about this. And as you know, my daughter was later to read, which as a reader, I was like, what's wrong? Why
I
isn't she
remember that.
reading?
Yes.
Yes.
And then her spelling was atrocious. And so I think, Lauren, you were like,
Yeah.
hey, is this something? And I was kind of thinking maybe it was. And then I realized it was her reading curriculum. It was like the Lucy Culkin's curriculum, which literally has destroyed a decade of kiddos and it's spelling and reading. And
Mhm.
so
Yeah.
she didn't have any of the other things, but those two, and those two were enough because of what you guys have said that made me think, do I need to be
Right.
looking into this?
Right.
And I think you're bringing up a good point about you may have some of the things, that we're talking about, and it certainly could be dyslexia. It could be something else like lack of instruction, and sometimes it's some other neurodevelopmental disorder. I've had families come in and they're like, oh, we think this is reading, and it turns out it's attention. Right.
Yeah.
And so I think that's one of the reasons why the evaluations can be so beneficial is to figure out what is going on. Because sometimes it may be reading, but it's not
Right.
actually dyslexia. It could be something else that's impacting that. And you won't know that until you do an evaluation to figure out all the pieces, right? So that's a
Yeah.
good point. Just because you are experiencing some of these things does not necessarily mean you have dyslexia. It could certainly be something else. And sometimes I'll have kids who read perfectly fine, but they cannot spell, right? So like there's nothing going on with their reading, it's just their spelling. So, or, vice versa. They can read, but they can't spell. So there's, dyslexia is one type of learning disability. There's other types of learning disabilities as well. And again, it's hard to differentiate sometimes unless you go and have an evaluation and figure out exactly what it is that is impacting your learning.
Lauren and Vanessa, I have my own experience, and I'm sure it's similar, but what have your experiences been with the reason I ask this? Let me back up a second, is I have heard from a lot of people in my personal life and professional life. Parents especially operate under the assumption that if there is a potential issue, ADHD, dyslexia, anything learning related, that the school or the teachers will come to me and they will say, guess what, mom and dad, I think your child might have dyslexia. You should get an evaluation.
Yes.
That is never been the case for me, but I'm wondering, Lauren and Vanessa,
Yeah.
do you think it's wise for parents to rely on schools or teachers to have a challenging conversation with parents about a potential diagnosis?
The very quick answer is no.
Yes,
No.
Do you like
right?
how I'm shaking my head?
Yeah,
I'm
like,
not
we
even
take
in
our
this
notice.
world. I'm
Yeah.
like,
You know what?
no,
That's
no.
not the teacher's fault.
No.
It's
Yes.
really, there is it's fascinating the more that I am in this world, right? And this has just been something for me in my private practice that it's probably the primary diagnosis I see just from word of mouth in my community. There is such a high misunderstanding and a lack of knowledge about what it is, even in the education world. It is, I hear all the time from parents, they'll say, I think something's going on. I want this evaluated. But school has said that it's a medical diagnosis.
Mm-hmm.
And it's like, okay, yes, it's a clinical, medical, neurodevelopmental diagnosis that primarily impacts the kiddo's full-time job, which is
In
school
school.
right now.
Right.
Right. So like there's a real misunderstanding of, yes, it's a medical diagnosis, if that's what, if that's kind of what the education world sometimes will say to parents, not always. Again, I think it's highly dependent on the educators or the school's knowledge,
Yeah.
right? So sometimes there are educators that have gotten training in structured literacy intervention, right? Which is what we want for dyslexia, which we'll talk about. So they see it. Sometimes they have personal experience with their own children, or they've seen somebody else that came through a couple years before a child that was evaluated and got this instruction, right? And so sometimes you'll get that recommendation or that referral from a school system that has had the experience and they kind of understand what they're looking at, but that is not always the case. And unfortunately, a lot of parents think that is the case, right? And so
And
it's a later diagnosis.
I've had a lot of parents then say, so my experience has been similar where I absolutely have had some parents come to me because the school said, we think there's something going on with their learning. But more often than not, it's the parent, it's now they're moved on in the grade and the parents like, there's clearly something going on. They're having a hard time. And now they're starting to dislike school. It's impacting
All
their
those secondary
self-confidence,
symptoms,
right? All those secondary things. It's causing anxiety. They don't want to go to school. And so, yeah, I do think that some of the schools are good about it, but one of the things, parents are like, why didn't they say anything? And I'm often saying, I think there's a lot of reasons why. I absolutely agree. I think sometimes they don't even know what this is.
Yeah.
We talked about kids being really good at masking. And so I think some kids can get pretty far through school, masking. And so, but it's the parent on the other end who's seeing the struggle with the homework, the like having to help them read through the thing, right? So, which the teacher's not seeing because you're just bringing the final product to school, right? You're bringing that great essay that you spent 10 hours with your kid, right? Trying to get them to read it and write it, whatever. And so they're not seeing the struggle piece of it at school necessarily because the demand is just different of what they're doing and what you're doing at home with them. So, and then sometimes I do think it's difficult for teachers to have those conversations too. I do think that happens sometimes, that they just don't want to upset a family or they're not sure, right? So I think there's a lot of reasons why this may not be brought to parents' attention, especially in those younger years. You mentioned COVID. I think I can't tell you how many times I've had families say, we thought there was some thing going on, but COVID,
Mhm.
I
you
know.
know, and I'm like, yes.
4
And
years later, we're still having that conversation.
right. And
Yeah.
so,
Mhm.
absolutely, we know that kids fell behind during COVID. For sure.
Yep.
We know that. However, we are now so far out from that that's not a realistic,
Mhm.
thing to kind of say, oh, that's probably COVID at this point. And we
Right.
all have kids at different stages of, and, if none of our kids are having that issue, they've all been through COVID, right? So like, if it was something that was going to be long term, all the kids or the majority of the kids
Right.
would be in the same boat, and they're not. And so we've had to have these discussions too about, at this point, we can't say this is COVID anymore. But I
Right.
could absolutely see why during COVID we were like, well, it's hard to say if this is truly a learning difference or not.
And I think with schools in general, teachers are completely overworked. They have so many
Absolutely.
things on their plate.
Right.
And I think Terry, we have talked about how we see kids just out personally that we're like, that kid has ADHD, and the teacher will maybe mention it in 2 or 3 years. Like, we have had these conversations. And I think teachers, whether it's learning or whether it's something more emotional going on.
Mhm.
I actually had I have a patient I work with, and her kiddo was experiencing extreme anxiety that was leading to like school refusal, and she was
Yeah.
young, and the school literally said, wait, let's just wait this out, I think she'll be fine. And I said, do not wait this out. I said, what you are describing, this has been going on for almost 2 months now. What the wait and see, it would have
Wait and
passed.
see.
You need to get
Yeah.
her in, because it's
Mhm.
only going to make it worse.
Yeah.
And
Right.
so that was just about anxiety. And they literally told her to wait it out for the year. And I said, do not wait
Yeah.
this out. Go. And so
Yeah.
I think it's not just this. I think that is the school. Do not look to the school, and it's not the school's fault,
Right.
Nope.
but do not look
Right.
to the school, because they are going to really only say something when it is
Extreme.
much extreme and
disruptive
making their
disruptive.
classroom disrupted. Yes.
You got
So do not wait. Do not
Right.
wait.
And they can't be expected to be
Mhm.
diagnostications
100%.
Absolutely.
Right.
That's
and
not their
Absolutely.
job.
interventionists.
They can't.
No,
They can't
right.
be everything. They
Right.
cannot.
And the
So
other
you have to be your own child's best advocate.
And the other
Absolutely.
thing that I think happens a lot for, I think, both parents and educators, and maybe everybody, is that they are trying to piece out, is this ADHD? Is it dyslexia?
Oh, yeah.
Is it
Yeah.
anxiety? When the reality is comorbidity, meaning overlapping
Mhm.
diagnoses,
Yep.
is the norm,
Very high.
not the exception. So I think
Absolutely.
parents are looking, we don't know if it's ADHD or if it's dyslexia, but the comorbidity rates are, what are they?
Pretty high.
Yeah, they're pretty high,
They're high.
between 40%,
I think it's
Yeah.
40%.
40%. Yep.
Yeah.
Yeah,
40%.
between
Yeah.
ADHD
High.
and dyslexia. So
Right.
if you're looking at dyslexia, you should also at least be exploring the possibility of an ADHD profile and vice
Mhm.
versa. And
Right.
parents and educators will say, I don't know if it's dyslexia. I think it's attention. It might be ADHD. Well, there's also this possibility that could be both, right?
Right.
Even
Mhm.
likelihood
Right.
that it could be both. So you're not
Right.
looking for either or. Schools in general, and this is a piece that I always bring up to parents, what is called the dyslexia paradox, or the
Mhm.
wait to fail. So in the
Yep.
United States, the average grade level that kids can be diagnosed is usually by end of second grade, early third grade. And dyslexia, like Vanessa mentioned, is it 1 in 5 kids?
Yeah.
Right? Okay. So
About,
1 in
yep,
5
20,
kids,
25%. Yeah.
but only 20 to 30% of those kids will ever receive an actual diagnosis.
Right.
Yeah. So here's another
Uh,
stat for you. So 40 million adults have dyslexia, but only about 2 million have a diagnosis.
I
Yeah.
believe-
Like,
Wow.
The
it's
amount of
crazy.
parents that
Yeah.
I say
believe
when
that.
I'm going through signs and symptoms and we're gathering information, and they'll be like, so that's me, right?
Oh,
Because it's
Wow.
genetic.
yes.
I
There's a
mean,
genetic
so
component
it's
to it. Yep.
absolutely the way the brain is organized, and there's that genetic piece to it. And there's so many parents, our generation and beyond, that were never
Mhm.
diagnosed.
Yeah,
Yes.
sometimes I'll have, it's not even the parents, they'll be like, oh, my brother or
Mhm.
grandpa or grandma,
Yeah.
right? So
Oh, of
it's either
course.
their
The
parent,
family.
their sibling. So there is a genetic component to
Yep.
this. And I tell families, I kind of say to them, it's just like the color of our hair and the color of our eyes. If it runs in our
Yep.
family, it increases the likelihood that we also will have that same color
Yep.
hair. And so if it runs in our family, that means that it increases our risk compared to someone where they don't have a family history of
Right.
dyslexia or any
Right.
other learning difference for that matter, or ADHD as well.
And I
Right.
will often ask parents when I do the parent interview, which is the first step typically of the evaluation process, I will
Mhm.
say maybe nobody in your family has received a formal diagnosis,
Mhm.
but has
Yeah.
Right.
anyone had trouble learning to read? Is there anyone
Yep.
with maybe a suspected ADHD profile?
Yep.
Is there
Yep.
anything
Right.
mood, et cetera? Because if we think about, like you mentioned, previous generations,
Yep.
stigma, et cetera, most people, the likelihood is very low that some people that they will have received an actual diagnosis.
Yeah.
Right. Right.
Yeah.
And so
Absolutely.
looking at those, yes, oh, grandpa was a non-reader,
Yeah.
or uncle so and so really
Mhm.
struggles with spelling still to this day.
Yeah.
Like
They
all of
got
those
extra help in
pieces,
school.
they
Right.
got
They had an
extra help in
IEP.
school, but
Yep.
I don't know what it was called. Right.
Yes.
Exactly.
Yep.
All of that's super helpful information as a parent in kind of looking at your child and looking at your family members and going, is there something here?
Absolutely.
Whether during the evaluation process or in thinking about getting an evaluation.
And knowing
Even
that family history is like so important because we
Right.
talked about early intervention, right? So if you know it runs in your family and you're seeing some of these early signs, then absolutely, it is a reason to go and seek out further evaluation to determine if your child does in fact have a learning difference. Because we know even though it's genetic, you can learn strategies to
Yep.
become a better reader. And so
Mhm.
even though this is not just something that affects children, like this is a lifelong disorder. I've spoken to, college age students who have come back for an evaluation,
Mhm.
um, for a reevaluation because they
Mhm.
want to continue to get supports in college or beyond. And they will say to me, while I can read now, it's still hard.
Mhm.
So,
Mhm.
they describe it
Mhm.
as like, I know what I have to do to read
Mhm.
and I can, but it takes a lot of effort, more effort for me.
Still
It's still,
inefficient.
it's still not, efficient,
Mhm.
but they
Mhm.
totally can read. And we know there's
Mhm.
lots of famous people who have had dyslexia.
Who are
Um,
some famous people? Who are people who, that we would be surprised? Like, oh, they have
I was gonna
dyslexia?
say, you wouldn't be
Albert
surprised, but
Einstein.
well, yeah.
Yeah,
So
Albert
some
Hmm.
of I
Einstein.
mean,
Yeah,
some of them, Whoopi Goldberg was one of the first person that
yeah.
used to do, remember those, like, The More You Know? Like,
Yes,
Yes.
yes,
right?
Yeah.
the
She
star.
was one of the first
Reading
people that right,
Rainbow.
right.
Yeah,
That
yeah,
would, like,
Oh.
stay, on one of those, I don't know,
yeah.
after school commercials.
Steven Spielberg,
Mhm.
George Washington,
Yeah.
Magic Johnson, Cher, and Chaz Bono, which genetic
Whoa.
right there.
Whoa.
Isn't that
Yeah.
interesting?
Yeah.
Uh-huh.
Mhm.
Orlando Bloom. There's lots of actresses.
Oh.
Jim Carrey, Jennifer Aniston, Jay
Yep.
Leno.
Patrick
Yep.
Dempsey, I think
That's
I
him
read
too.
that
Is
years ago.
dyslexic.
Yeah.
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 Mhm. He
Aaron
left school.
Brockovich, Tommy Hilfiger, Henry Ford, Walt Disney, like
And all
very
of that really
successful,
makes sense.
creative people.
I was going to say, because
Mhm.
they, like Terry was referring to earlier, the idea of like masking within the academic setting if they're capable or for as long as they're capable. But there's so many strengths in the way that their
Yeah.
brain processes information as a whole. It just doesn't
Mhm.
process this piece
Yeah.
very efficiently, right? And so those strengths usually, often, especially if they are fostered, come out in different ways. And so you see a lot of celebrities or famous people or really smart people that have
Mhm.
these entrepreneurs. There's a higher
Yeah.
percentage of entrepreneurs, right? Because they have figured like, oh, okay, this 9 to 5 kind of office setting, like, is not going to work for me, right? Reading memos
Right.
or whatever it is.
Mhm.
And so they kind of branch out into kind of other areas of creative professions.
Well, and that's what I'm hearing is that this is a learning disability. This is not
This is
about
an
intelligence.
unexpected
This is not
learning
about
difference.
intelligence.
Right. No.
Yeah.
Super, super smart people have
Yeah.
dyslexia. So this is
Yeah.
not anything about IQ or
Oh,
anything
right.
like that. This is about how they learn. I think
Yeah.
that's so key with what you're saying.
And
And
Yeah.
the earlier that they can understand that, the easier it is for those kiddos to be
Mhm.
able to kind of accept it and work through the intervention and really understand and feel that way about themselves.
And the other high profile person I would like to mention is there is a famous former Blackhawks hockey player, Chicago Blackhawks, named Brent Sopel, who I have been connected more recently with his charity. He wasn't diagnosed with dyslexia until he was 32 years old with both ADHD,
Wow.
dyslexia, and
Yep.
dysgraphia, which is a handwriting
Mhm.
learning disorder that often accompanies dyslexia.
Yeah.
And he was diagnosed because his daughter was struggling. He
Yes.
received the
Yes.
diagnosis. He then was listening to the information and realized, oh my gosh, I grew up feeling like I was the dumb jock, is typically what he
Yeah.
says.
Yeah.
Very skilled hockey player, obviously. He's from Canada. And he then didn't receive his diagnosis until age 32. He has now started the Sopel Foundation for Dyslexia, which is a wonderful organization and charity that is really trying to highlight how common and pervasive this is, the
Yeah.
most common learning disorder, and how impactful early intervention is and accurate detection for kids, so they don't feel like they're dumb and they don't feel like,
Yeah.
they just
That's
don't get it.
great.
Because a lot of them, like you said, Wilmina, really are very bright and are very intelligent, but don't feel
Yeah.
that way because, like Lauren said, school is their job. And
Right.
if you can't do your job well, that feels terrible for kids.
Awful.
Yes.
Yeah.
Oh,
Right. That
What
early
are-
intervention piece. That piece.
What grades?
So we keep mentioning it, right? So between the ages of 6 and 10 is when the brain is most
Yeah.
welcoming of a different type of approach. Now, what's interesting, Wilhelmina, you referenced this earlier, the type of intervention that is recommended for dyslexia is structured literacy, multisensory structured literacy intervention. It works for all kids. So you
really?
had mentioned, Wilhelmina, like my daughter was struggling and it was
Right.
the type
I
of,
was like, tell me more. I'm going to write it
but
down.
that's the thing is like they can teach this as just your general approach to learning to read in schools, and many do. However, many do not. Right. And so that's where learning kind of really being your own best advocate and your child's best advocate and understanding like what is the approach to reading instruction in your child's school becomes really, really helpful in knowing how my child is going to fare, right? If there is a learning problem for my kiddo, can I go to the school to get the appropriate intervention or should I seek it elsewhere? And sometimes that's the recommendation that we will give is because your child's school does not offer the appropriate intervention for dyslexia, go ahead and we're going to do it privately. And you can just ask the school, let's accommodate the child within the classroom setting, but I don't want them to receive small group or individualized instruction. And sometimes I will recommend that because it's more frustrating to the kiddo if they're doing something like a whole word reading approach. That's not what they need. They need this structured literacy intervention that's really explicit and teaches them how to take apart and decode words. I mean, that's kind of the basics of it. And like I said, all kids can get this at those young ages. So kindergarten to third is about that age range we're talking about, right? But they don't always offer it.
Oh, that Lucy Calkins. It was snap words. You had to learn the whole word. And Maddie was like, what is this? And I was like trying to teach her to break it down. She's like, that's not what they want us to do. I'm like, that's what I want you to do. Break it down. Break it down.
Phonics,
Right? So
hooked on phonics is the
we all
way to
learned
go.
that way. Exactly.
Yeah.
So they shifted. There was a shift in educational instruction in the early 2000s is what I have learned from educators that I've had conversations with about where did this whole word reading approach come from? So there's a shift in their education. So again, it's not their fault. There was just a shift in their education. And while that approach works for some kids, it definitely does not work for kids with learning differences or dyslexia. And structured literacy intervention works for all kids. And so the hope in some of the schools and districts and, with some of the educators that I speak to, and I'm sure this is the same for Vanessa and Terry, the hope is that there will be this kind of push towards structured literacy intervention as the approach to reading for all kids because it works for all kids. Hooked on phonics. We go back to the basics,
There's a very well-known, not well-known, but a very popular NPR segment called Sold a Story. And it came out maybe last year on NPR. It's called Sold a Story, How Teaching Kids to Read Went So Wrong. And it's all about the politics and the history behind what Lauren's describing and what Wilhelmina's describing about this Lucy Calkins whole word approach and what a disservice it has been for kids. And it also does touch on how pervasive dyslexia is, how common it is, and really how things went so terribly wrong. And now we're boomeranging back to effective strategies. And what Lauren spoke about is if it seems like the school is not doing the structured multisensory literacy approach for interventions and you have to pursue that privately, the accommodations she touched on can be just as important though, in terms of working
Absolutely.
with the school, things like extended
Mhm.
time, small
Yep.
group
Mhm.
testing, extended time is going to be obviously a first line strategy for kids with reading deficits. So they can
Mhm.
take when they
Reading.
need.
And then there's also things, so like in addition to working, so it's not, I also tell parents, it's not just working with a tutor, like going over the same thing the
No.
same
Mhm.
way is not what
No,
they
it's a
need. They
specialized.
need to work
Yes.
with a reading
Yes.
specialist and be taught a different way because the way they're being taught is not working for them.
Right.
And so that differentiation, but there's also things at home that I think parents can do as well. So, early on, reading to your children, like
Mhm.
that's good for all kids,
Yeah.
but
Yep.
especially kids who may be like, we know there's a family history, for example, of dyslexia. So those
Yep.
kids who are more vulnerable, the kid whose, language is delayed, those
Right.
are the kids that absolutely should be read to early
Mhm.
on and
Often.
encouraged to read.
Mhm.
Yeah, often. So I
Mhm.
was reading to Everly before she was even born. I would sit in the chair and I just like read to her. And that's something that we've kind of just continued to do. Like every
Yeah.
night she's like, Mom, you got to read to me. You got to read a story to me. And so just things like, reading, we've talked
Mhm.
about some other things about watching the movie and then reading the book.
Mhm.
I'll also tell families, for the child to listen to the audio
Yep.
version of the book while
Yep.
they're following along in the
Yep.
hard copy.
You got it.
That exposes them to vocabulary that they may not be able to figure out on their own, but
Mhm.
now they've heard it and they can see it. So that's
Yep.
like another good strategy. I also tell parents, if your child doesn't like to read, whether it's because they don't have an interest or because they are having difficulty reading, making sure that we're offering them, books in whatever
Mhm.
subject they like. So it
Yeah.
Yep.
doesn't have to be, like if they're
Yeah.
like, I don't, I like basketball or I like sports, fine,
Yep.
great. Get a book or something that they can read that is sports related. And so forget about, what the list is at school when you're at
Yep.
home and really focus on what do they enjoy so that we can present that topic to them so that they can have books on whatever it is that they're interested in, because that will help hook them into like doing the reading.
So
And
graphic novels.
I was just gonna say that. I
Mhm.
was like, Maddie, that's what hooked
Mhm.
Maddie.
Yeah.
She started devouring graphic novels. She
Yep.
would read them in like
Mm.
a day, and
Yeah.
then she'd get another one and another one. She'd reread it. So that's when I was like, okay, we got
Yeah.
something. That was the first thing that really enticed her to reading. And now
Yeah.
she is starting to extend beyond that. But I had to really hold that sacred because a lot of people would be like, but she's got to read some other stuff, my mom included. And I was like, let's just start here.
I've
This
Mhm.
is
heard
the
that
first thing she's reading.
I've heard it from educators too, Wilhelmina, to your point. So I'm glad that you pushed that.
Yeah.
Right? Because that becomes really important this is something that she likes and it will go forward.
Yes.
She will advance beyond that.
And I see
Right?
that.
Yeah.
Are there any book recommendations maybe we could put out there that would be good for parents?
Yeah.
For parents on dyslexia.
Yes. Yes.
Mhm. Yeah, we
So
can
we are
definitely
gonna
put them out.
post some links on Instagram. So if you're following us,
Okay.
we'll post some links there. And if you're not following us, please do follow us. We will also post some links and resources in the notes for the episode. So if anybody's interested in just learning some more information about dyslexia, you can check us out on any of these socials. We'll be posting some resources for folks who are listening.
Great.
Any
Yeah.
last minute thoughts about dyslexia?
Be your kid's own best advocate. You mentioned
Absolutely.
the parent intuition. Follow it.
Ditto.
And then reading specialist, is that like, would we Google reading specialist and like, how would we find a good reading specialist versus a tutor?
Right? That's a great question. So you're going to want to have that buzzword of
Okay.
structured literacy intervention. Orton Gillingham is
Mhm.
probably the
Yep.
most common one out there.
Popular, very popular.
And it's
And
if
Wilson.
you have a reading
Wilson.
specialist, yep,
Linda
that is
Nudell's another one.
certified in one of these.
Okay.
And again, we can post some links
Yeah.
that are appropriate, and it will be so effective for your kiddo.
Absolutely. Well, thank you for joining us today. We hope that you enjoyed our discussion on dyslexia. We will be sharing links to the resources we mentioned, as well as some additional resources on Instagram and Facebook. Please join us next time on The Shrink Down.